I will fight you more, Jim.
Yes.
On this one.
Yeah. Yeah, or look disappointed. You could look really downtrodden. And I could even give him a little hug. Yeah. Good evening, and welcome to the Autism Blogcast Special Report. I'm Jim Mancini.
And I'm Rafe Bernier. We continue to be laser focused in bringing you the inside scoop in autism news and information.
This month, we're focusing on the similarities and the differences between autism and ADHD.
We'd like to start with a brief 30-second overview of the history of both disorders. Now, both of them share some similarities in terms of the diagnostic labels and the way we characterize or think of each disorder. So we kind of all know as autism-focused researchers that the term infantile autism first emerged in 1980 with the third edition of the Diagnostic and Statistical Manual of Mental Disorders, the DSM. And then in 1987, there was a revision to the DSM where the term changed from infantile autism to autistic disorder. 1994, with the fourth edition of the DSM, then we moved to the inclusion of Asperger's syndrome and pervasive developmental disorder not otherwise specified as an additional diagnostic entity. And then in 2013, we moved to the umbrella term autism spectrum disorder. Now, ADHD has had a very similar type of progression in its own development. In 1968, with the second edition of the DSM, that's where we first hear the term hyperkinetic reaction of childhood. Bit of a mouthful.
Yeah.
But then that was revised in 1980 to become the term ADD, attention deficit disorder. That was revised in 1987 to become attention deficit hyperactivity disorder. Then in 1994, with the DSM-IV, there was a movement to keep that same label but include diagnostic subtypes. So predominantly an attentive type, predominantly hyperactive type, and then a combined subtype. Now in 2013, we maintain those same divisions, but there's been a number of other changes, as well as, most importantly, the ability to diagnose ADHD and ASD in the same individual.
Right.
That's a big change in 2013.
Well, Rafe, that was definitely more than the 30 seconds you promised, so I'm going to have to be extra succinct.
Not so easy for you.
You're hurting my feelings and wasting our time. So, that change that you mentioned of being able to diagnose autism and ADHD together really has some important clinical implications. Prior to that, we spent a lot of times trying to fit children into these boxes, and when we couldn't put them together, a child would either be have autism or have ADHD. Certainly, when we think about autism, the attention deficits that are present are pretty well known, especially at a young age. Difficulty with shifting attention, difficulty with development of joint attention. The research has indicated that 44% of children who have a diagnosis of autism also have a diagnosis of ADHD, and there's a significant minority of children who have a diagnosis of ADHD who also have that diagnosis of autism.
Indeed, right. So some similarities there, but I just want to highlight some of the discrepancies just with that statement you made, Jim. Both ASD and ADHD have social deficits, but we want to think about some of the qualitative differences, and here's my example. Say, for example, you're working with an 8-year-old child has social deficits. Now, we can conceptualize those as very different if you were an 8-year-old child who was incredibly impulsive, hyperactive early on, interested in peers, but very hyperactive, very impulsive. And so then you end up disrupting your peer relationships because you're being isolated because the other kids just really don't want to be around that impulsivity and hyperactivity. Now, that's very different from, say, an infant who is not engaged or interested in peer relations. Maybe not attending to faces as much, not engaging with peers. That's a very different type of social deficit following that early impairment. So I just want to highlight that.
Yes. So one of the similarities is certainly that they both present with social deficits, but the qualities can be different. Another similarity is the need for treatment. Both children with autism and ADHD benefit from early intervention, and the earlier we intervene, the better the outcome.
Right, indeed. Again, but I got to just jump in here just to provide some clarity, some nuance here about these differences. Now, so we know that behaviorally based interventions are effective for both in terms of improving outcomes for individuals with ADHD and ASD. We know that parent training can be an important component of that. But again, one key difference I want to highlight is the use of medication. Medications are very often utilized in supporting youngsters with ADHD. We see medication use a lot in individuals with ASD as well. However, with ADHD, we can address the core symptoms that are part of the diagnostic nomenclature, that deficits in impulsivity, hyperactivity, attention. In autism, we don't have any medications like that are treating the core symptoms of autism. We're addressing some of the comorbid challenges, whether it be anxiety, depression, or attention challenges.
Yeah, it's a fair point, and something that we really should be talking about a little bit more in depth, but we just don't have the time today. Yeah, thanks to you. There are some other similarities that are present in ADHD and autism. The ratio of males to females is higher. Their children with autism and ADHD often present with anxiety and depression symptoms, and both have we see sensory differences in both ADHD and autism.
Yeah, and those similarities there I got to highlight really bear out in terms of some of the twin work and family study work that have been done. So one of the interesting findings is regarding the origins of both ADHD and ASD. So if we look at twin studies, some interesting work that suggests that if you are a member of a twin pair and you have a sibling, or you have autism, and your twin, who is identical twin, has a much higher rate of having ADHD than we'd expect. However, if you have a twin who is a fraternal twin, you have autism, we don't see that same increased rate of having a sibling with ADHD. So twin work is suggesting there's a relationship there between ASD and ADHD. Similarly, family studies suggest that if you are a child with autism, you have a much higher likelihood that you're going to have a parent or other family member with ADHD. Again, suggesting there's commonalities there in terms of the origins of both disorders.
Right. So, speaking of twins, there's been some interesting work that looks at the relationship between inattention and restricting repetitive behaviors in autism and ADHD. And this relationship makes sense because if you have a child who presents with inattention, it may be due to this hyperfocus on some of these restricted interests or repetitive behaviors. And there's some nice clinical implications here. If we were to design a treatment that focused on decreasing restricted repetitive behaviors, that could have a positive impact on their attention. Or vice versa, if we really focus on attention, we may see a decrease in some of these restricted and repetitive behaviors.
Right, of course, we'd need to explore that further.
Yeah, if we only had time, okay? Which really returns us to effectively identifying, the characteristics of autism and ADHD. If you have a child who presents as ADHD at an early age and has some language delays and some sensory differences, man, that can look a lot like autism.
Well, I can imagine then, similarly, if you were sitting in there with a child who has autism, who's incredibly impulsive, very hyperactive, it's kind of hard then to differentiate. Maybe this is ADHD.
Yep. So one thing that we can agree on, Rafe, is that these disorders are complex, and this overlap presents us with a complicated diagnostic picture. When there are features of both autism and ADHD, it's really important to identify these key obstacles because that's going to allow us to plan treatment pretty effectively.
I agree. What I guess I'm most excited about is this move towards thinking about the common origins of these symptoms. And so we can move away from thinking about this diagnostically based on kind of our loosey-goosey clinical terms, but more thinking about this from biology and how biology interacts with development. Really, the work that's happening in genetics is pretty exciting. I actually could talk about that for the next hour.
Sorry, Rafe. That's all we can do. That's all for this month's special report.
See you next month.
See you next month. It's okay.
I covered for you. Just remember that.
Thanks, dude. Appreciate it. Really do.